uploaded the presentation earlier. So
you can do it by yourself because we can share for you. What do you prefer?
I uploaded, so the technical team will sort of.
Okay, Nikos, go ahead. Thank
sure.
you.
Can you see it now?
Yes.
You need to go full screen, Nikos.
No, I think it's fine. We can see the slides.
I don't think I can.
No, you cannot move.
Nico, let us share for you.
Can share it for me.
One minute, Nikos.
Yep.
Yeah, it's fine.
Is it okay now?
Yeah, it is.
Okay, next slide, please. Now go to the next slide.
Just a minute.
Okay. I was saying that this is a 67-year-old woman who had a severe calcified aortic stenosis, and in 2023 with a mean gradient of 90. Then it was an Evolut Pro Plus 29 was implanted with a post dilatation, a very good result, no stenosis. And after that, she had bilateral mastectomy due to breast cancer, and she received chemotherapy with anthracycline, but no radiation. Let's skip that. Next slide. 3 months later, she developed again signs of aortic stenosis. That was 3 years after the index procedure. We repeated admissions to the hospital, and then we performed the transesophageal ultrasound, which again showed severe calcification of the evolut leaflets and severe stenosis of the TAVI with significant transvalvular aortic regurgitation. We discussed that with the heart team, and obviously there was a high risk for surgery, and we decided to perform a TAVI and TAVI procedure with the Sapien 23 this time. Next slide. This is the CT, in which you can appreciate the calcification of the evolut leaflets. And next slide. And then we had to make some measurements, of course. Virtual valve to coronary to the left was 7 millimeters, to the right was 4. But the valve to aortic distance, which is the place where the valve is closest to the aorta, whereas that the coronary or the STJ or another place, this was 3 millimeters, and it was borderline. So we decided to protect the coronaries with obviously with a chimney technique, and one reason for that was that we decided to implant the second valve at node 6 because we were afraid that the leaflet overhang of the previous valve might cause stenotic phenomena after the implantation. Next slide. The other problem we faced that this lady had a bovine type arch, which means that the left coronary was coming off the brachiocephalic artery, and this is a problem to sort of put and advance a sentinel, but nevertheless we decided to go ahead with the sentinel. Next slide. And this is the TOE I was going to show. This is the 2D when you can see the calcification of the evolut leaflets and the gradient. Next. The color Doppler, where you can see the severe aortic TAVI regurgitation. Next. And this is the procedure. This is the aortogram pre-implantation. And on the right side, this is the arch, and you can see that the left carotid is coming off the brachiocephalic, just vaguely, but that was the case. Next. This is the sentinel. It was done with some difficulty, but finally we found the place we wanted to sort of deliver the system. Next. There was some difficulty crossing the valve. We didn't have support with the standard catheter, so we had to use an AL1 guide, 7 French, and we finally succeeded. And the gradient, hemodynamic was 90, as you can see. Next one. This was the protection of the coronaries. We tend to use in this case is a mother and child technique in order to pull back the guide catheter and have some space to deliver the valve. So we left a wire with a guide liner and the left main stem. The next. Pre-dilatation with a balloon. And here is the implantation of the sapien. Next. Next slide, please. And you can see that although there was a very slow implantation, there was at some point the valve tended to go up, but nevertheless we managed to stabilize it. In these cases, I think slow inflation is the key. And then followed by a double tap technique. Next. And then we did some injections and we found out that there was no need to protect the left main as the flow was sort of normal, and we did not proceed with a stent to the left main. Next. This is the final angiogram. No aortic regurgitation and a very good result, as you can see. Next, please. So the gradient was of near zero, trivial gradient. Next slide. So I think two things. First of all, what caused this early degeneration of the evolute valve? As far as I know, there's no definite connection between chemotherapy with anthracycline and progression of aortic valve disease. There's definitely connection with heart failure or progression of mitral valve disease as a cause of secondary to left ventricular dilatation. But there are some cases where they mention that it might be a possible connection, but certainly we don't have any definite answer to the question what caused this early degeneration of the evolute valve. And the second thing is now that these TAVI and TAVI procedures and get more and more we get more and more often, then we have to be familiar and acquainted with a new sort of complex terminology. All this valve to coronary, valve to STJ, valve to aorta. And what we need to have in mind, let's go to the next, please, is that when we put a new valve, and the first sort of scheme here is sapien and evolute, which refers to our case, is that creates this new skirt area, which is the area that the stent of the new valve pushes the leaflets. And if there's not enough space left, or if this space is between less than 4 millimeters at the level of the coronaries or the sterntubular junction, then we have to sort of think of protection of the coronaries. Next, please. And then we have to do some measurements. If this new skirt plane is below the coronaries place, obviously there's no real problem. But if it's above, then we have to measure not only the valve to coronary, but also the valve to aorta distance. And if all these measurements are below 4 or below 3, then there's a higher risk of sort of sequestration and disturbance of flow to the left main, which would be devastating. Our case, I think, was a bit borderline, and maybe we're overreacted a bit with the protection of the left main. Next, please. But I think our decision to put the Sentinel was correct. As you see, this is what we found in the filter, and we set it for some microscopy, and the answer came back. It was large pieces of calcium and thrombus. So although the data do not support the sort of routine use, I think in this case is redo TAVI. Sentinel is a thing that we should always think of. Thank you.
Νίκο, σε ευχαριστούμε πάρα πολύ. Νομίζω είμαστε λίγοι και καλοί τώρα, γιατί έχουμε περάσει σε after hours. Νομίζω πως ήταν φανταστική επίδειξη. Νομίζω καλά κάνατε και προστατεύσατε. Better safe than sorry, ειδικά με τις balloon expandable βαλβίδες. Έχουμε κάποια ερώτηση?
It was really, ήταν καταπληκτικό, ειδικά αυτό με το Sentinel. Συμφωνώ, αυτό θέλω να πω, ένα πολύ όμορφο case. Συμφωνώ ότι το Sentinel είναι individual decision making. Δεν μπορούμε να πούμε δεν το χρειάζεται κανείς ποτέ, και είναι πολύ σωστή παρατήρηση. Μερικές φορές πρέπει κανείς, και ας μην είναι statistically significant, να το θέσει κανείς under consideration.
Okay. Ευχαριστούμε πολύ, Νίκο. Χαιρετίσματα Θεσσαλονίκη, και τώρα έχουμε τον Ηλία τον Κοσμά.